That weather update. He will be back here on the show to keep you updated as to how things are looking on the weather desk. Now, yesterday, the Health Ombuds released the much-awaited report on the Health Ombudsman reporting to the deaths of psychiatric patients who were moved to various NGOs across the Gauteng province. The report has revealed that 94 patients died and not 36 as recorded by the Gauteng Health Department. The Gauteng Premier David Makhura announced during the media briefing yesterday that former MEC Qedani Mahlangu resigned on Wednesday evening and that Dr. Gwen Ramokgopa will now be the new Health MEC in Gauteng. He also communicated his regret and the circumstances under which the people have lost their lives. We joined this morning in our studios in Johannesburg by the head of communications from the office of the Premier in Gauteng, Thabo Masebe. And Dr. Masebe, it's a very good morning to you and thank you so much for coming through.
Good morning, Paris.
Thank you so much. Now, let's just start with the resignation of the former MEC of Health. When she resigned on Wednesday evening, rather Tuesday evening,
night,
yeah. Had she already seen the report?
Yes, she had seen the report. You'd remember that the Health Ombudsman actually gave her a draft report much earlier in January. So she had seen the report, or at least she was aware of
the recommendations
what was
thereof.
Contained in the report, the findings and recommendations,
all right,
or the contemplated findings and recommendations.
So what happened? She stepped down voluntarily, or was it the recommendation by the Premier? Because the recommendations from the Ombudsman report had stated that Premier must take, tougher action against her.
Yes, indeed, but she had already accepted that she was accountable politically for everything that happened in the department. So by the time they discussed with the Premier, obviously Tuesday night was not the first time they spoke about this matter. They would have spoken over time, but by the time she decided on Tuesday, she had really thought about the matter. She had looked at all the issues and she accepted that as the political head, she was ultimately responsible for all the actions of the department, and she felt it would be proper for her to tender a resignation.
All right. Now that she's no longer MEC of Health in Gauteng, and of course she's no longer a member of the provincial legislature, does it mean that that she's off the hook in terms of taking responsibility and accountability?
Well, as the provincial government, we will have to look at all the matters that the Health Ombudsman is raising in the report. So it's not only the MEC, we have to look at all the people that are cited there as having played a role there and say what corrective measures do we take. The recommendations are clear on what we have to do as the provincial government, and the Premier is committed to acting. He has already set in motion a process to deal with all of those recommendations. The other thing is, what do we do with the patients that are currently...
Just before you get to the issue of the patients, let's just go back to the issue of the former MEC taking responsibility and accounting to what happened here. We had the Minister of Health yesterday during the briefing saying that he actually made mention of institutions like your NPA and SAPS that they will have to be looked into. Are you saying that the Premier, as it is now, he's also considering those institutions?
Well, the report makes clear findings and recommendations. We'll follow all of the issues that are raised by Professor Makhuba in the recommendations.
Any intentions of laying criminal charges, maybe not just to the MEC, but to everyone involved from the health department? I'm
saying we'll have to follow all the issues that are raised in the findings and recommendations. If Professor Makhuba is saying we must refer certain matters to other institutions, will have to refer to those institutions which are duly authorized to deal with such matters.
Now, to your knowledge, in the day, Masebe, as the office of the Premier, who approached the Health Ombuds? Because we've seen on the resignation letter by the former MEC saying that she actually approached the Health Ombudsman to investigate this matter, and yet we were of the view that the Minister of Health is actually the one who approached the Ombudsman to investigate.
Well, I think now what is important is that both the Premier and the MEC, when this emerged that a number of people had died, agreed that we need to do something about this thing. And one of the first steps was to get an investigation. And at that time, in the discussions with the Minister of Health, the minister then felt strongly that the Health Ombudsman would be the most appropriate institution to investigate the matter.
I was asking that because a lot of people are actually questioning what she said on a resignation letter, saying that she's actually the one who approached the Health Ombuds for investigation. Nonetheless, talk to us about...
I think what is important now is that the Health Ombudsman investigated and was able to find these things that we now have to deal with. A lot of things have been exposed by the report, by the investigation, and these are helping us to take the necessary steps to correct whatever wrongs that happened, but also to ensure that we do not place lives of people who are under our care in or at risk.
Yeah, because I believe what is also important now is the steps to be taken by the provincial government in terms of ensuring that the remaining 1.3 people that are still at those NGOs are saved before it is too late.
Yes, indeed. That's a matter that we are immediately working on now. The Premier has instructed or set up a team led by the Director General in the Office of the Premier, and today they are already visiting all those NGOs where the people are located. And at the same time, they are looking at state facilities or any facilities within the province with which are properly equipped to provide the kind of care that we need to give to those patients.
And Dr. Masebe, what was so difficult for the provincial government to find the exact number of the psychiatric patients who had died? If you were to compare 94 to 36, that's a huge difference right there.
Well, I don't think at this stage we need to get into that. These are some of the things that we'll have to look at the systems.
But South Africans would like to hear answers from the provincial government. The South Africans would like to know as to why did not the provincial government detect the problem. You are in charge of this provincial government. You should know better. You should be hands-on, isn't it?
There was an investigation. What is important now is that
it is
the
important,
investigation has revealed information.
Based on the report, South Africans and the family members of those patients involved, they are still looking for answers to find closures. So they would like to know as to why did not the provincial government get the correct number.
We are dealing with all of those issues. Remember the fact that we had to investigate, and now what is clear is that the department may not have had accurate information. But now we have information. We have information on the basis of which we are able to act to save lives of people, and act to ensure that the systems of our education, of our health department, are geared to providing the kind of care that we have to, that we are expected to provide to our people.
Yeah, and we've seen a whole lot of people. Here I'm referring to your ordinary South African citizens, including the influential people calling on the Premier to resign. The ANC Youth League on its own said that the Premier should resign because this happened under his watch.
Well, people are saying the Premier should take responsibility, and he takes responsibility.
What responsibility
taking
has he
responsibility, taken? That is why he's seized with the matter now. He's been dealing with this matter. Last year already, he met with the families to convey his message of condolence. At the same time, to commit, to give his commitment that is going to work with them until all these issues are resolved.
But is it really enough? Is it really enough, Dr. Masebe, especially in terms of taking accountability? This is not a fairly new matter. It broke back last year. And what has the Premier done?
Yes, no, we're saying that's why I'm saying he's taking responsibility. And by taking responsibility, he's saying, I'm not going to walk away from this problem. He's going to ensure, to see to it that he solves this problem. The first step is to implement all the recommendations of the Health Ombudsman. And he has already set in motion processes to implement all those recommendations.
But he agrees that this happened under his watch.
Well, he agrees, yes, and that is why he's dealing with the issue. So how is he taking
accountability? Has he considered
Yesterday he spoke, he apologized to the families. He also again reiterated his message of condolence and regret that the actions of the provincial government may have contributed to factors that led to the death of people. But he didn't stop there.
Yeah.
He then says, as the Premier, I'm committed to implement all the recommendations of the Health Ombudsman. And as I said, he has already set in motion a process to implement all of those
resigning is not on his
recommendations.
cards. I am referring to the statement by the ANC Youth League and other influential parties here in South Africa. Resigning is not currently on
we're
his cards.
talking the Health Ombudsman.
No, I am asking you as a spokesperson. Surely you've conversated with him over this issue, so
Yes.
it's not something that is
we
considered.
are dealing with the report of the Health Ombudsman.
All right. No, it
The
looks
Health
like we're not
Ombudsman
gonna,
says to the Premier, there are specific actions that you need to take. And the Premier agrees fully with that.
All right, that
and
we
he
get.
has already set in motion a process to deal with all of those
All right.
issues
Now,
that
let's
are
just
raised.
quickly move further, Dr. Masebe. Any assistance or perhaps recourse for the families affected? A quick one on this.
Well, yes, we are in consultation with the families. This is a matter that will not be decided only by government.
Yeah.
It's a matter that will have to be dealt jointly by government and the families. So we are dealing with that issue.
And Dr. Masebe, thank you so much for your time.
Thank you very much.
Thank you very much indeed. There you have it. Thabo Masebe is the head of communications from the office of the Premier in Gauteng. He's also the spokesperson, really, of
Yes.
the former deputy president. No, I think the details are wrong here, what I'm reading. But he is the spokesperson for the Premier, the Gauteng Premier David Makhura, talking to us about this report. Okay, what I'm reading here in Dr. Masebe is totally wrong. Well, there is a tweet in Dr. Masebe. Let's quickly take a look at that tweet from Unati Grootbom saying everyone who was involved in a live Esidimeni saga must face the law and must be put behind bars. Another one from Teboho Ramaselele. Qedani Mahlangu must be jailed. She lied and showed no remorse when she was interviewed on this show about these deaths. All right, another one from Penny saying that this is more than just embarrassment. This is shocking, insensitive to say the least. Thank you so much for those tweets. Let's keep them coming, and we're taking a break. When we come back here on Morning